us as well. So I just want to welcome everybody to Hope Connections educational program tonight, Good Nutrition for Cancer Care. I know we're all excited for tonight's presentation on nutrition, and it's my pleasure to introduce our speaker, Patty Gay-Berry. Patty has been a dietitian for the past 30 years. She attended the University of Maryland for her dietetics degree and did her internship at Hood College. Patty is certified in oncology nutrition and integrative and functional nutrition. In her spare time, Patty likes to run, swim, bike, or do yoga and cook. Patty, we're thrilled to have you here with us tonight, and anybody who has been here before to listen to Patty knows she's a wealth of information, and I know that this is going to be such a helpful session. So thanks again, Patty, for being here. I'm going to turn it over to you.
Okay, thanks, Stephanie. I hope I can answer your questions, and if I change up the slides, we're going to be focusing on gut health, but if there's more questions at the end, and if I'm not hitting some of the things that you want to on this PowerPoint, then just ask them at the end. So can everybody see my slides? Okay, awesome. So I'm going to be talking about gut health during cancer treatment and beyond. And so we'll first go through like what is proper digestion, review gut permeability, what is your microbiome, dealing with poor digestion, tips for adding more fiber, and supplements that might be helpful. So first off, with digestion starts in our mouth. So having good saliva helps us with starting the process. There's actually enzymes in our saliva that helps with the digestion. And then as food goes down your esophagus and enters into the stomach, that's a very acidic environment. Now, a lot of people are taking anti-acid medications, and that might be a problem because we don't want to be always taking anti-acid medications because we need acid to break down our food. And so your stomach is in a very acidic environment. And so those gastric juices start turning all the food around and mixing it all up. Just think of your stomach as your blender, and it turns all the food into a super soupy mixture called chyme. And so acid is important. So if you have poor digestion, there might be some things to test on yourself on acid. And then as we go down further into as your food goes down and you're eating, then the pancreas and the gallbladder secrete digestive juices. The gallbladder secretes bile. And then the pancreas secretes tons and tons of digestive juices. Even just smelling food probably causes us to have some digestive juices secreted. And that happens in the small intestine, and that helps your body break down the food even more into smaller particles. And that's where most of the absorption is happening in your small intestine. So this part in the middle, your middle part of your small intestine, if it was folded out into like opened up, it's supposed to be the size of a tennis court. But it's all looping around these little loops and stuff. And then from the small intestine, where we absorb most of our nutrients, then the mixture enters into the large intestine, and that's where it goes up and over and down. And that reabsorbs a lot of water and helps to make the stool more compact. But the large intestine is also where we have trillions of bacteria that actually help with our health. And that's a big, huge focus of research now, is looking at the microbiome and the connection of the gut bacteria in our gut to our brain health, to heart health, and everything. So really want to focus on good digestion is important. So starting right in your mouth. And, a lot of people can have poor teeth, like bacteria on their teeth, that can lead to inflammation throughout the body. So if your teeth are in poor repair, or like I have, my mother, anyway, in my family, it's more common to have gingivitis. So I have to be really on top of flossing and different things. So there's even tests that I went to a dentist recently, and there's a test you can do for just your mouth microbiome. So not your gut microbiome, but your mouth microbiome. And if there's bacteria in there, then there's rinses that could be helpful to get rid of that bacteria. So there's a dietitian, just sometimes when I meet with people, and if you ever have met with like a functional medicine dietitian, their intake questionnaire is humongous. And a lot of them are asking questions about what is your bowel movements like, and diarrhea and constipation. And they're like, why are you asking all these invasive questions? I'm just here to see you about what I eat. But if you have poor digestion, that's affecting your absorption of the nutrients in your food. You can't absorb your food if you're not having good digestion. So, and then poor gut health leads to poor digestion. If you have poor digestion, you're not absorbing your food, and then it kind of can lead to poor quality of life. I'm not going to get into there's different diagnoses with poor digestion, but in general, that's why I might ask you some of these questions. In bad breath, like that could be possibly a dysbiosis in the bacteria, and it's leading to bad breath. So again, so all of these things interact. So as I mentioned, your microbiome is your large intestine, and now they believe like trillions of bacteria live there, trillions. So like we have tons of skin cells, but like we have triple the amount of bacteria in our gut, and we're born with that. And nowadays, like some intake questionnaires might ask you, how were you born? Were you born vaginally or through a C-section? Because you have less. There has been studies on people who are born C-section don't have as much good, healthy, strong, robust bacteria versus vaginal birth, where they get that bacteria as they go through the birth canal. So it starts when we're like born of these good bacteria. But in our microbiome, it's about the size of 3 to 5 pounds, and that's how much bacteria is in there. And there can be, like I mentioned, there's good and bad. There's always going to be a balance, but and not all bad are bad. Like it's just if there could be an overgrowth of the bad, then that can be a problem, and that can cause dysbiosis. Or maybe and there are tests that you can do. One that I've done for some patients is called GI map, where it will tell you if you have a good, robust amount of good bacteria versus they call them instead of bad, they call them the opportunistic bacteria. So you can see if you're having gut digestive issues, there are tests that you can do to see what your mix is. And then medications can cause a disruption in your gut microbiome. Of course, you've probably all heard that like taking antibiotics can pretty much wipe out all the good and the bad. And then what happens if we're not really paying attention and making sure we're eating a lot of these good foods to help rebuild the good bacteria, then the bad can just grow easily. Well, again, I shouldn't say bad. It's like opportunistic bacteria. They can grow more if you have eat a typical American diet, like high sugar and highly processed foods. If you drink a lot of alcohol, if you're under a lot of stress. So that's where a lot of the opportunistic can take over. But our whole microbiome is really, if it's working well, what things that it does, it helps further digest our food. It helps synthesize vitamins. There's a specific vitamin if you have good microbiome health, like you're in eubiosis. Like if it's not good health, it's called dysbiosis. But if it's in good health, it's called eubiosis, or just working well. You can produce a vitamin called vitamin K2, which is very important for bone health. So there's a lot of different vitamin Ks. There's vitamin K1 that's good in your clotting factor, and we get that from green leafy vegetables. But then vitamin K2, it's hard to get a lot of food sources of vitamin K2, but if your gut's working good, your gut produces it. A good microbiome helps support immunity. It helps play a role in neurotransmitter production. So they sometimes call the microbiome our second brain, because through the vagal nerve, we have a nerve that goes down to our gut, up to our brain. And if things are bad in our gut, it could possibly, there's a lot of research on depression and anxiety and things like that, because they can talk to each other, or cravings. So there's a lot of research on that. A good microbiome produces anti-inflammatory compounds, which is good for us, and helps filter and reabsorb nutrients from the foods we eat. So we really want to focus on having a good functioning microbiome. And how would we know if we have a good microbiome? Well, one is making sure you have a good bowel movement every day, which we'll be talking about. I'm getting ahead of myself. But so when and I forgot to mention, like, chemotherapy can be a way that maybe it disrupts your microbiome. So, and then there's also people that are on immunotherapies, and they already know before they are even placed on the immunotherapy that this might cause diarrhea. I'm blanking on the name of it, but there are some immunotherapies that can cause diarrhea. So, so this is kind of, I put this in here to just kind of show you what might be happening. So leaky gut is a real thing. It maybe 10, 15 years ago, when I've been a dietitian for a long time, if somebody said leaky gut, like, we would just look at people and say, oh, that's not really true, but it is. And you can also hear or think of it as gut permeability. So what can happen is there at the top part here, triggers causing intestinal damage, which is leaky gut. That could be if you're not digesting certain proteins well, like gluten, like the protein in gluten. Here's the low HCl and enzymes, so that's low acid. Antibiotics can come problems, and infections such as H. pylori. Some people might have it and don't even know it. And a good functional test could kind of pick that up for you. Blood sugar issues, antibodies. So if you have autoimmune type things, then your body is reacting to that and have high antibodies. Even having menopause can cause like lower estrogen levels can cause gas and bloating. So that could be a problem. Stress. So that's why we want to make sure we're kind of controlling our stress as best we can. Toxins in our environment, that could be toxins from food. If we microwave our food in plastic, if we're eating, certain types of foods, or it also could be toxins in our environment, like skincare products that we might use on our hair, skin, or nails. It could be new car smell. Like, there's just lots of toxins we're exposed to all the time. And then food allergies, and then food intolerances could be lactose intolerance or whatever. Sometimes people's bucket, think of like you're exposed to all these things, and you have a bucket, and at some point the bucket overflows, and then you start to have digestive leaky gut type problems. So if you look here on the left-hand side, you can see that what they're showing is the microvilli, these intestinal mucosal cells. Think of a shag carpet. They used to, I don't even know, people don't have shag carpets these days anymore, but back in the 1970s, there was something called shag carpets, and you would think there's like all these little projections out. So think of your small intestine and your large, and was mostly in your small intestine, but it has these little cilia or microvilli, and they're supposed to go back and forth and stay real close together, and they help absorb nutrients from your diet. And they're real tight together. So those tight junctions are called zonulin. And with being exposed to the things above, if it's diet, if it's poor acid, whatever, these tight junctions can get broken and open up. And that's when different bacteria or different things that should not be going through, go through and can cause constipation, diarrhea, all kinds of like symptoms, gas, bloating, abdominal pain. And so I just wanted to put that out there. So then there could be, you're not absorbing your food as well because it's going through your system too fast, or some people might get autoimmune type issues, such as Hashimoto's, or which is a thyroid condition, or all kinds of different autoimmune issues, food intolerances, blood-brain barrier breach. So some people might experience depression, and systemic inflammation that could be like heart problems or arthritis, or so this is kind of what they're talking about when they're talking about leaky gut so far. Okay. So I was going to go over tips to help improve gut health. One thing may be to sip, if you are experiencing something called leaky gut or gut permeability, due to chemotherapy, due to life exposures, whatever, bone broth can be a great thing to help heal the leaky, the gut lining. And why is bone broth helpful? Because back in the day, we Americans, we don't eat like the whole entire animal anymore. Like back in the day, people used to like make soups from the bones of things and things like that. But now it's like skinless chicken breast, and we don't even have the bones available to us most of the time. So for me personally, I had to like make sure I buy like a whole chicken. So I'd like get some bone broth. So bone broth can be, it's so what is in it is that the bones have been soaked and cooked for a long time with a little bit of acid. So usually a recipe will call for apple cider vinegar, and helps get those nutrients out of the bones. And those nutrients are actually good for our body. And our body needs them, but we have it like the typical American Western diet has been devoid of that. So, so bone broth can be helpful. Collagen peptides can be helpful. So what I do personally is I put a scoop or two of collagen peptides in my coffee. It's unflavored. And so it's just providing some extra protein, because collagen peptides is not a complete protein. That's why you won't, when you look at it, it won't say protein, because it doesn't have all the amino acids, but it has a good amount of them. And so you don't want to rely on it as your sole source of protein, but it can be a good way to help heal the gut. It also can help with healing your nails, like if your nails are breaking or really tender and things cracking and things after you've been through chemotherapy. It also can be good for hair. So I'm a big fan of the collagen. But you always want to make sure you're getting collagen that's from grass-fed animals. And then if you make bone broth, you want to make sure you get bone, you try to get grass-fed animal bones. Or if you're doing chicken broth, it would be chicken bone broth. It would be you're using good quality bones from like a organic pasture-raised chicken. And you can recook the bones. If you decide to make your own bone broth, you can recook them like 2 to 3 times before you throw them out. So I've like made some bone broth and then put the bones in the freezer. So that's another option too. So to help improve gut health, we want to try to focus on fermented foods consistently. That's the thing, consistently. Increase plant foods as tolerated, and we'll go over that. Decrease toxic foods and get a good amount of sleep. So sleep is super important. And stress, however you can control your stress, the better. So some people may benefit from doing like meditation. Other people might go for a walk. Some people pray, deep breathing. So working on a stress release that works for you can be good for gut health. One thing is just doing deep belly breaths before you eat can help just relax your system. So that's another thing to do if you notice you don't digest very well or get gas and bloated right after eating. So this is just a bone broth recipe that I had gotten at a conference I went to. And you'll notice over here, kombu is added. Kombu is like seaweed. You can buy it at most stores. Look in this, like the seaweed section. It's like a seaweed from Maine or something. But kombu comes in these long strips, and you can just cut. She wrote a 4-inch strip, so probably cut it in half because they're long strips, and it grows to this big piece of seaweed in your soup. You don't have to eat it, but it provides iodine and minerals that we need. That's good for your thyroid health and things like that. So, and it does provide a lot of nutrition. The other thing, kombu is good for if you make your own beans. It can help decrease the gassiness from beans. So it gives a lot of flavor. You don't really have to eat it because it kind of is like slimy, but it just provides these nutrients while you're cooking. Another bone broth, like if you're never going to make bone broth, because it's kind of like, okay, this is challenging. You can have some brands that I like. Bonafide Provisions is it's in the freezer section of the grocery store. I've gotten it at Mom's, and you can cook. You can cook your bone broth. Like if you don't want to sip bone broth, some people sip bone broth and they make it taste really good. And it's like instead of coffee, they're drinking hot bone broth. But if you're not somebody that if you're not going to sip bone broth, you can still use the bone broth to make soup. You can use your bone broth to make add it to your rice or your pasta, or cook with it. Add it to foods to give it more nutrition in your food. The other brand I like that looks good is called Kettle on Fire, and that I've seen. It's not in the freezer section. I like the one in the freezer section because there's nothing added to it. It's just bone broth and frozen. So how some things are on shelves and they might have like added things that could be disrupting to your gut. But the frozen one, Bonafide Provisions, is just bone broth. But Kettle on Fire I've seen on the shelf, and it does look good. It's like from organic animals or organic grass-fed animals, and looks like minimal ingredients. So that's one as well that might be good. So we want to try to eat more fermented foods. The trick is, like I said, is trying to do it consistently. A little bit every day goes a long way. So you don't need to eat huge quantities of these things, but it can be a little bit every day. So yogurt, of course, we don't want to get sugar sweetened yogurts. Like a plain yogurt is your best choice. And then you mix it with some fruit. Or if you need a little sweetener, you add the honey or the sweetener to it, because, when we buy it at the grocery store with added sugar, it's questionable how, the sugar doesn't help the microbiome. Pickled vegetables, you can make your own. You can, you want to make sure that if you're buying them in the grocery store, like a pickle, they're like fresh, trying to think, they're in the refrigerated section. They're not heat treated. Same with sauerkraut. Like some people will eat sauerkraut that's like with hot dogs, but that's been heated and there's no benefit once the sauerkraut's been heated. But if it's, you can get like raw sauerkraut in the refrigerated section that will say it's never been heat treated. That's the type of sauerkraut we're talking about. Kefir is drinkable yogurt. Kefir and yogurt, a brand I really like, if you really are trying to improve your gut health, is Nancy's brand. Nancy's brand is the only brand I know that like actually lists strains of bacteria. So some yogurts will just say, they'll just say live and active cultures, but Nancy's will say like a strain of type of bacteria that they're using. So that's the step above what most ones do. Tempeh can be a fermented food. And kimchi is fermented sour, well, it's like sorry, I'm blanking, Korean food, but it's more like fermented vegetables. So similar to the sauerkraut, but it has a lot of more spices to it. So really good for you. And kombucha, has anybody ever tried kombucha? I'm a fan of kombucha. I like it. You just want to make sure you're looking for the ones that are low sugar. So to make kombucha, you have to it's fermented tea. So it needs something to help the bacteria grow. So it has to have some sort of carbohydrate in there. So there can be some kombuchas that have high sugar content, and as if we were trying to be mindful of sugar, you can find some kombucha that's made with juice, like 100% fruit juice. So when you read the label, it will say 0 added sugar. That's the type that you want to be looking for. Or if you can't find that, just the lower sugar carbohydrate ones are going to be your better choices. If you've never had kombucha, it's an acquired taste, just like when the first time you ever had a beer or first time you ever had a glass of wine, you might be like, oh, I don't like this. But the more you eat it, drink it, it's kind of fun. They have different flavors. There's like lavender, there's just a lot of different flavors. So, and there's I like the ginger, I like the mango. I like it, I enjoy it. Just read your labels. Okay, so the other thing to think about with healing our gut is we want to increase our vegetables, and within those vegetables, we have your phytonutrients. And what are phytonutrients? So phytonutrients are nutrients that are in plants. There's no recommended dietary allowance for them, but there should be probably, but the only reason like vitamins and minerals, they have recommended dietary allowances because if we get deficient, like if we're like sailors on a boat and we've never seen, don't forget any vitamin C, we'll get scurvy and we could possibly die. Phytonutrients are so beneficial and they're in the plant foods and they protect the plants from bugs so that the plants can grow. And those same phytonutrients protect our bodies so that we don't get cancer or different health conditions as we age. So the more we can eat more of these plant foods, the better. And a lot of them, like even it, like all of, like when you think of the plant phytonutrients as bioactives, and little amounts, like even just adding some rosemary to your meal, or like if you're having potatoes, you maybe make roasted rosemary potatoes. That rosemary can turn on a gene called NRF2 that can, it's actually not a gene, it's a transcription factor. And when that transcription factor gets activated, then it activates a bunch of genes in our body that help our body function better, help our body fight cancer and inflammation and things like that. So the more we can eat these plant foods, the better. And lots of color gives us lots of variety of nutrients. So you could have a challenge of, okay, every day I'm going to try to get a different color in my diet, or you know, just try to challenge yourself of different colors, or you have to have 2 colors at a meal. Or if you're not a big vegetable eater and you're just trying to get started, like, okay, I have to just have some sort of vegetable or fruit at every meal. And just like, you can't sit down until you have like some carrots, at least, that you're going to munch on some carrots. Like, challenge yourself to get more of these nutrients in. They can make a difference. And if we are eating more vegetables, and when I say vegetables, you know, vegetables do not provide extra calories like the non-starchy vegetables. And if we eat too many fruits, if you have any blood sugar issues, that could possibly be a problem. But non-starchy vegetables won't cause a problem with blood sugars at all. But if you are undergoing treatment and you're having diarrhea, that's the time when maybe eating a lot of vegetables might be a challenge. So, and so there are some immunotherapies that can cause diarrhea. Of course, there's chemotherapies that can cause diarrhea. So basically, you want to try to eat cooked vegetables and canned fruits, totally fine. And then soluble fibers. So these are just some soluble fibers that can be helpful. If you are experiencing diarrhea, Enterade is a supplement that you may want to, I just saw a typo. It's an amino acid supplement, not amino acid, an amino acid supplement. And it looks like water, but when it has amino acids in it and electrolytes. So that's all it's in it. And you drink it on an empty stomach if you're experiencing diarrhea, and it can help at the gut level with that leaky gut. So that might be something to consider trying. Banatrol is another supplement to try, but it's completely like they work 2 different ways. So you could actually, if you're having diarrhea, you could try one for a couple of days or a week and then try the other. You could potentially use both if you're experiencing a lot of diarrhea. So Banatrol is dried banana flakes, and it has a prebiotic fiber added to it, and Banatrol helps bind the stool. So fiber as tolerated is what you want to do if you're in treatment. Now, to help you understand what type of stool is important for you, this is the Bristol stool chart. And ideally, most people, you want to have a stool that looks like the 3 or 4. So that's our goal. If it has an S shape, that's even better. That's like the shape of the colon, and a large. And your goal should be to have a bowel movement every day. So if you're not experiencing diarrhea, the goal should be to have a bowel movement every day. And some people say, well, I've never had a bowel movement every day. Well, that can be a concern, because your bowel movement is your way to get rid of toxins and things. So you may want to kind of keep focusing and try to get to having a bowel movement every day. So like I said, this is just, if you're having diarrhea, soluble fiber should be, like, I don't want you to leave this talk to think that you never want to eat fiber if you're having diarrhea. Our goal is to get to the point where we can tolerate some fiber. Maybe you won't be able to tolerate 30 grams of fiber because you're having diarrhea, but you want to be able to tolerate some fiber. So you want to start with a low fiber diet. We'd have, and on the side here, you got cooked carrots, green beans, banana, applesauce, oatmeal, mashed potatoes. Those all have the source of soluble fiber. And then these are some other sources of soluble fiber. What we want to avoid is insoluble fiber. So all fruits and vegetables have a mix of, well, most fruits and vegetables have a mixture of soluble and insoluble fiber. And it's the soluble fiber that can help bind the stool. And so that's why you want to try, if you're having diarrhea, try to have more soluble fiber. There was a nurse's study that showed that if you can also try something called psyllium, which is Metamucil. Psyllium, you can also get psyllium by itself, like that's not flavored or anything, it's just psyllium husk. You can take a teaspoon of psyllium husk and mix it with 2 ounces of water after a meal, and that might help bind the stool. So you don't eat anything after the meal, so you drink that, and then that can help bind the stool. Another tip might be to try this flax seed tea. So you would take full whole flax seeds and you soak them in water or in a heat, and then soak them overnight, and then make it into a tea. But you don't drink the flax seeds. You're extracting the soluble fiber from the flax seeds, and then you can add, you make it with your tea. So you do the hot tea and add in the flaxseed mixture, and that's a source of soluble fiber. So that might help as well. And you can add a little honey or ginger if that works for you. Now, if you're experiencing constipation, this is where you want to make sure you're getting enough. First, you don't want to like increase fiber without increasing fluids. So sometimes people can be constipated because they're dehydrated. So make sure you're getting enough fluids. And how much fluid, assess yourself. I mean, again, for diarrhea too, make sure you're drinking enough fluids too, because you can get dehydrated if you're having diarrhea. But your urine should look like pale lemonade. That's a good assessment. You can also do half your body weight. Like if you're like, how much should I do? Half your body weight is, so if you're 140 pounds, I can't do any math in my head. So 140 times 0.5, that gives me 70 ounces. And if I take 70 ounces and divide it by 8 for how many cups that would be, 8.75, so 9 cups of liquid a day. And you can get that liquid from drinking coffee or tea. You can get liquid from eating like things like watermelon and cucumber. You can make a watermelon cucumber smoothie. That can give you a source of liquid. So you want to make sure you're getting enough liquid. And then increase fiber. Our goal is to try to get up to 30 grams of fiber a day. And this is not a complete list. It was just from a handout that I had. You can chia seeds, add that to your list. Chia seeds are an excellent source of fiber. Kiwi fruit is another way to get a great source of fiber. So if you're experiencing constipation, maybe have a goal of having 2 kiwi a day. Mix it with that yogurt that you're trying to get some fermented food, and you know, you can start. It starts adding up. This is a recipe for like overnight oats. I got this from the Bloated Belly Whisperer book by a dietitian. And a patient, I gave this recipe. I have not made this, I have to confess, but it looks good. And a patient said she made it and she said it was really good. So if you make it, let me know. But you know, overnight oats, putting chia seeds in overnight oats, if you've done that, can be a great way to get some fiber. And why do we want more fiber? Because when we eat more fiber foods, the bacteria in the microbiome make something called short chain fatty acids. And those short chain fatty acids, one of them is called butyrate. Butyrate, it can really be good for the colon, helps prevent colon cancer, and things like that. So these plant foods, we want to focus on plant foods as your fiber, not focus on laxatives. Or I know you probably have been told just use Miralax or just take Colace, which is just a stool softener. So that's totally fine. But if you're, you know, if you're finished treatment or if your appetite's good and you can eat more of these plant foods, try to focus on plant foods as much as possible. There is a good book if you're really interested in the gut health. It's called The Good Gut, and it's by Jason and Erica Sonnenberg. And they talk about, they've done a lot of research on the gut microbiome and things like that. And they talk about microbiota accessible carbohydrates, and that acronym is MACs, MACs. And so they have all this information about why you want to eat more of these MACs, so the microbiota accessible carbohydrates. And garbanzo beans are great. You can see the apple in there. You know, have a goal of an apple a day, and eat the skin. Now, organic is always going to be better. Most of the nutrients are right under the skin. So if you have organic fruits and vegetables, eat the skin if you can. Now, if you're experiencing diarrhea, of course, don't, you know, the skin is where you're getting the insoluble fiber. So you may not be able to tolerate it at that time. And sometimes with digestive health, people have something called GERD, which is gastroesophageal reflux disease. And so some guidelines for that, you want to kind of avoid gastric irritants. So peppermint and spearmint may be irritating, chocolate, alcohol, caffeinated beverages. There is a nice coffee that you can substitute called Dandy Blend that looks like coffee. It's very dark looking, but it's actually dried dandelion, and that might be helpful. You want to avoid high fat foods, but the guidelines are like, of course, we want to avoid like the really, you know, donuts, like that's high fat and it's high in sugar and carbohydrates. And that's like I don't have GERD, but when I eat even bite of a donut, I just feel like it just doesn't go down right. It just feels greasy in my throat. But healthy fats, you know, don't avoid all fats. Like try to see if you can tolerate healthy fats. Well, what are healthy fats? That would be olive oil. That would be avocado. That would be nuts and seeds. I personally don't, I would not avoid all fats. And then some people have specific fruits and vegetables that they can't tolerate when they have GERD. So they say they can't tolerate orange juice, or they can't tolerate tomatoes. So
that's a good spot.
It's everybody's, so if you can't tolerate those things, just avoid them. GERD can be, basically it's telling you your gut is not your gut, your gastric lining that we talked about at the very beginning is inflamed. So taking something like glutamine might be helpful to help heal the gastric lining. You want to also wait 3 hours before lying down if you have, so if you've eaten, wait 3 hours. So don't eat late and then go to bed, because that can cause problems. And stress can be associated with GERD. So just doing those doing 3 deep belly breaths right before a meal, kind of relax your whole body system before you eat. Like if you're under stress and you're eating really fast and you're running, then that could be a reason why some people experience GERD. You could experiment with if you don't have gastritis. So some people have GERD and gastritis, but if you don't have gastritis, which is inflammation of the lining, you could try doing a little bit of apple cider vinegar with water, like a little bit of apple cider vinegar, maybe a tablespoon or half a tablespoon with 8 ounces of water. And you drink it before a meal and see if that might help with digestion. This might also help with people who say they get full quickly, like the food just sits there. So the apple cider vinegar, again, only half a tablespoon to a tablespoon in a cup of water. And you do it before a meal and see if that might help. And then for GERD, the glutamine might be helpful. There is a supplement called GI Revive that's got glutamine and herbs, but you may want to double check if you're on certain medications, you know, maybe you can't have the herbs. So you have to double check with your doctor or dietitian to see if it's if that's okay. this was an after meal digestive that I found. You can look up the website's Nutrition by Brooke. And she talks about how you can make your own candied ginger, but you can also buy candied ginger. So it's up to you. You can go to the website and actually read how to make your own candied ginger. But basically you take the candied ginger and you have dried orange peel that you just save from your orange peel. So make sure you get a nice organic orange, and then fennel seeds, and you mix those all together and you have it like a teaspoon after a meal, and it might help with the aiding with digestion. So you could check that website out and see. If you don't have GERD, but you just feel full after a meal, then maybe peppermint tea might be helpful. These are just supplements that might be helpful for digestion. So if somebody's experiencing constipation, magnesium can possibly be helpful. It helps relax the muscles, it gets absorbed. But you'd never want to take magnesium oxide, because magnesium oxide, that's what most people, like if somebody says, go get magnesium, they go to the pharmacy and get magnesium oxide. That is a laxative. I guess it could be helpful for constipation, but it doesn't get absorbed into your body. We need magnesium in our diet, and they believe that 70% of the population is magnesium deficient. And we need magnesium for up to 300 enzymatic reactions. So if you decide to try magnesium, you should try magnesium citrate or magnesium bisglycinate. Citrate can cause loose stools, so if you're constipated, citrate can help. Magnesium bisglycinate doesn't affect your stools, and it can help relax your muscles, like if you have sore muscles, or if you're not sleeping very well, it can be helpful with sleep. So magnesium at night can possibly be helpful. But if you do have kidney issues, you'd want to talk to your doctor about that. Now, just FYI, if you go to the doctor and they check your magnesium, which they seem to check, it's always going to be normal. Magnesium and calcium are always going to be normal unless you're really, really sick or you're in the ICU for something. Your body always makes it normal because magnesium, calcium are not in your blood. So if they're checking your blood for magnesium and calcium, it's always going to be normal, and because it's supposed to be in your bones. So it's just not a good, it's not a good marker. It's checking your blood levels of magnesium, calcium nutritionally is not very helpful. So just FYI. Some people may benefit from taking a probiotic if you can't tolerate the fermented foods. There's like different digestive issues that people may experience, and the fermented foods just exacerbate things. But you want to look for something that has a mixture of lactobacillus and bifidobacterium. And usually, like the same as for the yogurt, you want to look for a strain that, like the Nancy's yogurt lists strains. A good probiotic will list the strains, and they usually will. The strains are what the companies are studying, and research is studying for strains. Like there's some that could be helpful for diarrhea, some strains that could be helpful for constipation, some strains are helpful for weight management. So just going to the store and just getting a probiotic, and especially if it doesn't list a strain, might not be helpful. So just get a good one. If you guys live in Montgomery County, Village Green Apothecary is a good place to get any good quality supplements. So they're right in Bethesda. Prebiotics, like if you're dealing with diarrhea and you can't eat all the fiber, certain prebiotics can possibly be helpful to kind of help bind the stool. Digestive enzymes can be helpful. Digestive enzymes, they're just enzymes. Like maybe some people don't have enough enzymes to help digest their food. And how would you know? Like maybe if your stool comes out and it's yellow or orange or floating or greasy, like it looks greasy in the toilet, you should definitely be talking to a GI doctor or dietitian, because those are signs that maybe you're not absorbing the fat in your meal or different things. So so digestive enzymes help you digest your food and absorb your nutrients. And they are supposed to, if you do trial one, they're supposed to be taken at the start of a meal. You don't take them at the end of the meal. You take them at the beginning of your meal. And then I mentioned the glutamine can be helpful for healing the digestive tract as well. And I guess that's it. I don't know if so let me know. I can stop sharing here. And if you have questions, I hope that helped answer some of your questions.
Patty, thank you so much. Oh, go ahead.
What do you think of Metamucil? I actually take a fair amount of it and find it helpful. Do you have concerns about taking a fair amount of that?
Metamucil is soluble, is psyllium. So it's okay. Some are sweetened with, I believe some Metamucil can be sweetened with Splenda. So if you're worried about that, you get what?
Sugar free, although I guess it does have some artificial. So you were saying, I'm sorry, I interrupted you.
Well, you can get, I mean, it's up to you. If you feel like that works for you, that's fine. You can get just psyllium husk that wouldn't have any added artificial sweeteners. It's really up to you if you're worried about that.
Okay. No, because I found through a number of different drugs that it was good to tamp down diarrhea, and it also helps with constipation, and it keeps me regular, and my stools not to get too right where, the right shape. I really think it's been helpful for me.
Good. And then continue to try to get those vegetables in, just because it's not always about just the regularity, but it also provides you those nutrients that can be helpful.
I do try to get some broccoli and carrots and celery, and I could probably do more on that, but I'm not using it to substitute for vegetables.
Awesome. One vegetable I forgot to mention is broccoli sprouts. Has anybody tried broccoli sprouts? So broccoli sprouts, they're even more nutritious than broccoli. And you can get them at Whole Foods, I believe. I shop mostly at Mom's, and they definitely have them at Mom's, but you can even grow them yourself. Like, you don't have to put them in dirt. Like, if you just Google broccoli sprouts, how to grow them, it's like water, and you let them sit for a couple days. And I haven't made them. I need to do it, but I haven't done it yet. But so broccoli sprouts are super, super nutritious, and that master switch that I mentioned, the Nerf2, is the broccoli sprouts. When we chew them and eat them, it activates Nerf2, which activates all these other genes that are help cancer protective. So you can easily put them in your salad. You can stuff them in a sandwich. You could put them in a smoothie. If you're putting other things in the smoothie, I've done it. You don't taste any broccoli. So something to think about. If you see them, give them a try. Yes.
Sorry to interrupt.
Yeah, no problem.
I've been having difficulty with white blood cell counts, and also, I can't think right now. So the blood counts aren't good enough after the expected amount of time to take another chemo treatment.
Okay.
And I've been asking, what can I do diet wise? Because I have a good diet, I do a lot of the things you've talked about. And the doctors and the nurses don't have any help.
Well, the biggest thing is,
Yeah.
the biggest thing is assessing how much protein you're getting.
Okay.
'Cause, if you're not eating enough protein, that could be a problem. And so I would, at least, again, to assess how much protein you can calculate it by taking your weight and dividing it by 2.2. This is how I do it. And then if you don't have any kidney issues, I would, once you get that weight, then it would be, then you multiply it by 1.2 to 1.5. And you might get like a number that's like, let me just give you an example. I'll say somebody's 140 pounds divided by 2.2. That person's about 60, I'm going to say 64 kilograms. So then I take 64 times 1.2. I get 76. So I'm going to round it to 75. 64 times 1.5. So that person, if they're 140 pounds, needs 75 to 95 grams of protein a day. And then I take that and, like, how many times do you eat in a day? Do you eat 4 times a day? Do you eat 5 times a day? And you divide that 75 and 95 by 5 or 4, how many times you eat, and you try to get those proteins in. So if it could be a smoothie with protein powder, it could be a smoothie made with Greek yogurt. It could be Greek yogurt with fruit. It could be cottage cheese with fruit. It could be, so eating, and it could be fish. So the fish, this is a little piece of salmon. It's fake, but it's this is about the size of your palm of your hand, is about 3 ounces, gives you about 20 grams of protein. So you really want to make sure, of course, I talked about gut health and all the fiber and all that's good, but make sure you're getting protein. It's very important.
Yeah.
Patty, we have some hands up, so I want to also just
Okay.
make sure with time that we get to everybody. Monica, I know you have your hand up. Could you please ask your question?
Yes, in reference to, you spoke about the vegetables and the fruit. What seasonings are good for inflammation? And also, what is the name of the book that I think that you had mentioned? My doctor said that I need to have a more plant-based diet. I never was much of a meat eater. So if you can give me those two things, what's a good book for plant-based diet and seasonings?
Seasonings, I would say all herbs and spices are going to be good for you. So just don't use seasonings with salt in them. So if you like a seasoning blend that doesn't have added salt, and like I mentioned, the rosemary, turmeric, ginger, garlic is wonderful for you. Putting garlic, if you just take garlic, chop it up and let it sit for 10 minutes, the nutrients become more bioavailable for your body. So I chop up the garlic, then I chop my onion, throw my onion in, and after that it's been kind of simmering for a little while, then I'll throw the garlic in, but I let it sit for about 10 minutes to help make those nutrients more bioavailable. Now, a good book, gosh, I'm blanking. Let me see here. Oh, Jean LaMattia. Now, when your doctor says be plant-based, I would change that, because sometimes people think they need to become vegetarian or they need to become vegan. Just do plant-focused. You really want to up the plants, but eat good quality protein foods. So what is good quality? Try to have salmon. Grass-fed wild salmon's going to be better if you can afford it, find it. Sardines are awesome. You can get these at Costco. So sardines are very good for you. So do more of that. A book, one that I have here, let's see, this one. This is just one. I'll try to email maybe I'll email Stephanie some other ideas, but this one's Cancer Treatment Nutrition Guide and Cookbook. And it's by a dietitian named Jean LaMattia. So she goes over like symptom management, and she has survivor tips, and then recipes. Like if you're experiencing the low white blood count, she might have a recipe in here for that, things like that.
I have a good book.
Oh, wait. I'm sorry, Shirley, we got some hands up, so
Okay.
we'll get to you in a minute, okay?
Okay.
Sure, thanks. So John has his hand up. So John, if you're able to ask your question.
Thank you so much, Stephanie, and thank you, Patty, for this excellent presentation. I have a quick question about fermented foods. I'll try to be quick. My wife and I eat a lot of yogurt. That's our fermented food. And we eat a lot of Greek yogurt, whole milk, vanilla blend. Is that close enough to plain, or would you recommend we switch to plain Greek yogurt? Are you okay with Greek yogurt is the question.
I love Greek yogurt because you get more protein. So I love, that's a great way to get protein.
Good.
It's up to you. You know, it's sugar. You can look and see if that's the only sugar you're getting in a day. Like you don't add any sugar to your coffee. Like you want to kind of assess how much added sugar you're having. And so that might be kind of
Okay,
assess
that's
what you're
helpful.
getting.
We
Yeah.
tend to add a lot of berries to our yogurt. I hope
Yeah.
that helps. I hope
Yeah,
that helps.
and I love the whole milk Greek yogurt, like plain, like you can get used to it. Now over the years I've gotten used to it. So the whole milk is much creamier. I used to buy fat-free stuff. I refuse to buy anything fat-free ever again. So the creaminess of it is good. So you may want to start gradually seeing if you can get used to just the plain, and you put a little honey, or you can just put vanilla flavoring in the Greek yogurt.
Very helpful. Thank you.
Yeah.
That's a great suggestion. Thanks. And Nancy, your hand is up.
Yeah, thank you. Thank you for the presentation. It's excellent.
Sure.
And I'll just say very quickly to John, with Greek yogurt, what I used to do is grate apples into it and no sugar into full fat, and that helped, and also apple butter. So my question, I'm very excited to hear what you have to say about probiotic supplements, because when I first got cancer and was on Ibrance, I was taking a Nature Made, a really heavy duty probiotic. I think it was super something, and it listed all the strains and everything. And I could have entered a contest with my stools. They were wonderful. And every day. And then when I switched oncologists and went to MedStar, the oncologist was there, said, "Oh, no, it's too risky to take probiotics. They could leak and you could get an infection." So with much regret, I stopped. And I wish I could still, I'm thinking of starting again.
Well, I would check with, I forgot to mention that.
Not that I meant to
probiotics-
contradict you. I don't mean to contradict.
Yeah,
you.
no, I meant to mention, like, if you're on immunotherapies, like there hasn't been enough studies to know, but I mean, every oncologist, like you have to check and see which doctor allows things, but for immunotherapy, one study was on melanoma, and it wasn't, the probiotic was not good. So there's not enough studies to say that they're good for everybody, but I would talk to your doctor again, see if they
Okay.
are willing. Are you having digestive
Yeah.
issues?
I'm
Yeah.
going back and forth between diarrhea and constipation. Before I was on Ibrance for 2 years, and now I'm on chemo, a low-dose chemo, eribulin. And I
So-
tend to go back and forth between the
So
two.
some doctors or some research seems to think that the prebiotics can be more helpful than the probiotics. So you could, if your doctor doesn't want you taking a probiotic, there are some really good companies that make some good quality prebiotics, which is
Okay.
more fiber to help with the regularity. And one of them, if you're going back and forth with diarrhea and constipation, is partially hydrolyzed guar gum. And it's by a company called Sun Nutrition, I believe.
Okay.
Yeah.
Okay. And she has since gone to MD Anderson, so I'll check with my new doctor and see if she has a different opinion.
Okay. Yeah, I'm
Okay.
curious. Let me know.
Yeah,
what she says.
Okay,
Yeah.
I'll let you know through Stephanie.
Okay.
Okay, thank you.
Thanks, Nancy. And Shirley, I know you're on mute now, but if you can ask your question, and then this will be our last question. And if other people have questions that come up, you can always email me and I can reach out to Patty. And just before Shirley asks her question, I also wanted to let you know what I put in the chat, that the slides will be available. You don't have to tell me right this minute. You can also email me, because we do an evaluation that I will be mailing out to everybody tomorrow, and you can always respond to that email and just let me know if you want the slides and or recording. Okay, Shirley, I'm gonna turn it over to you for your question. Oh, you're on mute.
Actually, mine this wasn't really a question. I want to share this book when we're talking about books. I got this really good book. You might not be able to see it, but it's called The Cancer Diet Cookbook, and I got it from Amazon. And the author is Diane, Detraz, and that's the author of the book. And it's a really nice book. It's a cookbook, and it talks a lot about plant-based foods, but it is not leaning into being a vegetarian or anything like that. It's just talking about a lot of plant-based foods and stuff. And it's a really good book. I sort of read a lot of it last night, but I still have more to read. And I mean, it's not a real thick book, and and I think every time I try to get a recipe for something, I don't want a recipe for a whole bunch of stuff in it. And this book doesn't have a whole lot of things in it. I mean, it has things, but not things that you couldn't ordinarily find in the market. That's all I wanted to share.
Can you say that who's the author again? Diane?
I'm gonna spell her. It's Dionne. And her last name, did you get the last spelling of the last name?
No, I didn't get it.
It's Detraz, and it's called The Cancer Diet Cookbook.
Okay. Well, I'm not familiar with it, but I'll look it up. Yeah.
Yeah. Okay, thank you. That's all.
Thanks for sharing. And I just want to thank you again, Patty, for being here tonight and for sharing so much information. And again, I always learn something new. I love that you put recipes, in your slides, and just, good things for us to think about.
Thank you for having
really
me.
so helpful. And thank you all for being here tonight. And so when I do send out your email, I know some of you had messaged me that you want the slides. So of course I have your names down, but for anybody who does want the slides, who hasn't reached out, I am happy to send that and or the recording, and hope that everybody will fill out the evaluation and that everybody has a good night. And Patty, thanks so much again.
You're welcome.
Thank you.
See you.
Good night,
Bye.
everybody.
Thank you, Stephanie. Thank you, Patty.
You're welcome.
Thank you so much.
Thank you.
You all.
Thank you, everybody. Thank you, Patty. Thank you, Stephanie.
you.
Thank you.
Bye.
Thank
you.
you, Patty. Thank you, Stephen.
Thank you.
Take care, everybody.
You
Bye,
too. You too.
everybody.
Bye.